Hey, it's Dr. T here, and I'm here with Dr. Ian Spiegel. He's a veterinary dermatologist, and he's going to talk about there's new flea and tick products out there. In the old days, we used to use collars, we used to use topicals. They're still around, they're still effective, but there's new oral medications that are really good, and I think they have added benefits for other things, but I'll let him go now.
Yeah, so I guess in recent times, over the past 2 to 3 years or so, the flea and tick preventatives have certainly changed in terms of what our options are. I'm sure most of you are familiar with some of the topical, what are called spot-on therapies, which have been around for years, and many of them are over the counter at this point, so they're certainly readily available, and they are quite effective. However, one of the issues with those has been that they do certainly, with either swimming or even frequent bathing, can certainly wash off the product and maybe jeopardize the integrity and the efficacy of that product. So that has been an issue. The other is the distribution of those medications. Some of those that are applied topically are not necessarily absorbed systemically, and so may not really control complete coverage for the dog. You know, for instance, is the topical you're putting between the shoulders actually preventing ticks from attaching to the groin area or the inside of the back leg? So over the past, like I said, couple years, there have been oral therapy options. And those options you may have heard of or seen online, seen commercials, or talked to your vet about. There's one called Brevecto, another is called NexGard, and another is called Simparica. So there are 3 on the market right now from 3 different pharmaceutical companies. All of them are working very similar. It's the same drug class that they're all a part of. But the benefits are they're absorbed systemically, so they're there the whole time in the bloodstream, so they don't wear off or get washed off or anything like that. And so it's definitely provided excellent coverage for fleas and ticks, which is what they're intended for, but also post-market and off-label, they also seem to provide some protection against mites, some from the environment, such as scabies mites, which are carried by wildlife such as foxes, but also a mite that all dogs actually have, something called Demodex mites, which are not contagious to you or other dogs. They don't go from dog to dog or dog to person, but sometimes an overpopulation of Demodex mites can lead to clinical signs, skin problems, etc. And so these products are proven to be effective against that mite as well. So these products are certainly something to consider as part of your monthly control if you're using NexGard or Simparica. And the first one I mentioned, Brevecto, is actually labeled for every 3 months. So there certainly that may help or hurt with compliance depending on how you are in keeping up with things. For me, personally, remembering once a month seems easier than every 3 months, but that doesn't mean Brevecto is not a good product. It's just another option. And so we've come a long way with flea and tick preventatives, and that's pretty much a little brief update on that.
How can people get a hold of you?
Well, I work out of 3 clinics, Veterinary Specialty Emergency Center in Levittown, Pennsylvania, and Philadelphia, Pennsylvania, as well as Animurge, which is located up in Raritan, New Jersey, and Garden State Veterinary Specialists in Tinton Falls, New Jersey.
Okay, thanks so much, Ian.
Sure.